Okay, good afternoon, everyone. I'm Dolores Green, with the Executive Director with Riverside County Medical Association, and thank you for joining us today. And our partners, San Bernardino County Medical Society and the Inland Empire Health Plan, and all of their providers and members. We appreciate you joining us today. Before I do introductions for today's webinar, I would also like to let you know that next week's webinar, which will again be on Tuesday, June 9th at 12:15, and that webinar will focus on an update of COVID-19 testing and contact tracing in Riverside County. Dr. Jeff Leone from Riverside University Health System will be our guest speaker for that webinar. So please put it on your calendar. You should be receiving the flyer invitation this afternoon or early tomorrow morning, but please plan to attend, because I think everybody is very interested in what is happening with the COVID-19 testing, as well as now the contact tracing that is happening in Riverside County. So I would like to now move on to our webinar today and introduce our two guest presenters. The first is Lacey Mendoza, who is the Director of Customer Success, as well as Brittany Weppler, who is the Director of Sales. And at this point, I'll turn the webinar over to Lacey and Brittany. Thank you.
Thank you, Dolores, for the introduction. As Dolores stated, I am Lacey Mendoza. I'm the Director of Customer Success, and I will be going over the slides this afternoon, and Brittany Weppler, who is our Director of Sales, will have the fun job of showing you what it actually looks like right after I get through the stuff that I'm doing. So for those that don't know who Manifest Medx is, or you've heard about us and not completely sure what we do, we are a nonprofit health network. We serve all of California, helping healthcare leaders just like yourselves reach your goals of improving outcomes and reducing costs. We actually facilitate the secure exchange of real-time information on millions of patients across California. We have over 500 healthcare organizations, with our biggest footprint in San Bernardino and Riverside counties to date. We have 7+ health plans, and we actually receive results from Quest, LabCorp, and RadNet. Basically, our job is to get you the information that you need. So with that, what are we talking about today? We are talking about COVID-19 data available within our MX platform in a variety of ways that you all can use it, including MXNotify to know when real-time COVID-19 lab results are coming in, MXAccess, where you can find a broader range of those lab results and other COVID-19 related information within the longitudinal health record. And then lastly, we'll go over how to use MXAnalyze, which is our population health tool. It's a fantastic tool to identify a list of patients at risk of poor outcomes from COVID-19, and for those patients that have been tested positive in the past. So, before we move on, I just wanted to go over quickly the 3 products or tools that participants can utilize to provide better and safer and more efficient care. This will be the last time that I use the word products. I like to use the word tools, because to me, this is exactly what these are. These are things to help you do a job. The analogy I like to use is for mechanics, electricians, whatever it may be. If they don't have the right tools, they can probably get their job done, but it won't be as efficient or safer. And this is what we're trying to help you all accomplish. So quickly, the 3 tools that MX has to offer, and what we're going to be going over today as it relates to COVID-19, is MXNotify. That is actually our real-time alerts. So when your patients are admitted or discharged, you're notified in real time. It is customizable. And then we have MXAccess, which is our longitudinal patient record. We actually received claims data from some of our health plans and clinical data from multiple healthcare settings. This record includes things such as discharge summaries, encounters, meds, labs, procedures, you name it. It's in there. I love to encourage our participants to use those two tools together, especially for our providers. One of the workflows that we suggest, utilize Notify, come in during the day, check it once or twice or multiple times throughout the day, see who's been admitted or discharged, look into access into the record, get a little more information around that patient, and reach out to them. Schedule their 2 week after they're discharged PCP visit, and all of that. So those two work really well together. MXAccess is a great tool by itself as well. If you're a single provider, you can go in there and get set for the day for tomorrow for your patients that are coming in, if you need to print stuff out, if you want to look through it the night before, or even with telehealth going on right now, log into MXAccess while you're having that conversation with the patient and be able to have that conversation and say, hey, I noticed you were admitted to, let's say, RUHS. I see the visit here, let's talk about it. So you have access to that at your hands. And then MXAnalyze, which is our population health dashboard. It is a beast of a tool. So much can be done with this. We're not going to go into great detail about everything this tool has to offer because we are talking about COVID-19, but I do have Bill Devane, who's on our team, who hosts bi-weekly webinars on MXAnalyze if you want to learn more about it or get a little more information on how to use it. So with that, let's go on to the next page here. So quickly, we're going to first talk about MXAccess and what we're doing around that. As I stated, MXAccess is our longitudinal patient record. But the great thing that we're doing right now with COVID-19 lab results, we're actually displaying, let me go back. Oh, wait. Oops. Okay. We're actually displaying a banner at the top of your patient record to notify one of your patients has tested positive for COVID-19. What this does is it allows the users to not have to dig through the whole record before knowing if your individual or patient has tested positive. So that way you can go directly to the lab if you want to see it. If you want to see, certain documentation around it, you can go directly to that as well. You know what you're looking for and not have to dig through it. If your patient has had a COVID test done but has not had a positive result, the test will still be in the lab section, but we won't show the banner because we're only showing it to you when it's positive to notify you. Now with MXNotify, the notifications tool, as I stated, currently we were doing admit and discharge notifications. The great thing that we've added to this is COVID-19 lab notifications. In the MXNotify portal piece, you are able to be notified about your patients that have been tested positive for COVID-19 from the organizations that we work with currently. These are only positive results, but if you want to know about positive and negative COVID-19 results, we do have another option, which is a daily batch file with both positive and negative COVID lab results for that prior day. And they're delivered to another website, an SFTP site. It's just a website. You can use the same password if you want. Easy to get to as well. But like I said, it's a CSV or an Excel file with both positive and negative results. But what do they look like? So just quickly on the Excel file one, the one where you go into the SFTP site, it is a daily batch of notifications for positive and negative results. The files are received daily at 7 a.m. On that website. So 7:01, go in there, take a look, see your positive and negative results. And it actually provides new notifications since the prior file received 24 hours earlier. But that file, that CSV file, has columns for patient demographic data, name, address, date of birth. I think we even have a column in there for death data. So if a participant or organization sends us a death flag on that patient, we will populate it. But the piece that I wanted to show you guys here today is we have a couple of columns here under test code, test description, test alternate code, and test alternate description. So basically this shows you the LOIN code and the description of them, and the reason why we have a test and a test alternate is sometimes the organizations provide a local code in the first section and then the LOIN code in the second section on the data that we receive. We want to make sure that we capture everything we can on the test results, especially since it is new, it is COVID-19, and we want to make sure that we provide you the information. This last column here is a column I think everybody's looking at. It's the test result, whether it was negative or positive. So CSV file provides both negative and positive results. What do they look like in the portal? And Brittany, who's going to be doing some of the demoing on the COVID-19 piece, especially around notifications, she will have a more in-depth, clearer picture of what this looks like. But I wanted to provide you a reference of what it'll look like, especially if these slides get passed around. But basically, we have a test result label here for those as an event type. So you can see that it was a test result, not an admit or a discharge. And then you'll also see that the chief complaint is tested positive for COVID-19. So that's what that's how you differentiate between admit and discharges and the test results. So the last couple of slides, there's a lot of information. I do speak quickly, so I do apologize, but I wanted to provide an overview of what I discussed. Basically, MXNotify platform, that's on the portal. It will show you the positive results. You also have the CSV file on the other SFTP website, easy to get to as well. That will show you the positive and negative results. You do have an option to choose one or the other, or you can choose both. We have quite a few of our organizations or participants that choose both. They want to know in real time when a patient is tested positive, they can do that outreach. And also they want to be able to know who's negative and both positive. And, you know, maybe later on run a report based around that for those that are great at using Excel. To receive either one of these notifications, you have to do a couple of things. Really easy. Number one, be a participating organization with Manifest Medx. First step. Second step, have an active patient roster panel set up for MXNotify. That is actually an easy step. And what we mean by that is we just need a list of your patients that you want to be notified about. We are actually working with some ambulatory sites as we speak, and some of the more common EMRs, we do have instructions on how to download a patient roster. And so we can actually try and help and work with you to be able to do that quickly. If you would like to get set up with the notifications or even signed up with Manifest Medx, we would love for you to reach out to Jana Ariano with Inland Empire Health Information Organization, and I've included her email address in here as well. And then the last tool that I want to quickly go over before I hand it over to Brittany is MXAnalyze. That's our population health tool that with COVID-19, we're utilizing it to identify high risk and COVID-19 positive individuals. So we put a couple of filters in place. One filter is called COVID-19 outreach, and the other one COVID-19 cases. The COVID-19 outreach, so basically we take your population, so we can utilize the same patient roster or panel that we use for Notify, and we can use it for Analyze. But basically what that filter does is it populates those that have had a diagnosis in the last 12 months as it relates to increased risk of poor outcomes from COVID or for COVID-19, such as cardiovascular, immunocompromising conditions, cancer, etc. So what we've done is we've taken all of those diagnosis that makes an increased outcome or poor outcome for COVID-19. We put it all together. You're not having to go through every diagnosis. We put it together and created this filter. And then it's able to download from your list of patients all of those that would likely benefit from a proactive outreach during the pandemic. So you're being proactive with this filter here. You're able to download a list that includes demographic information such as date of birth, age, gender, phone number to be able to call that patient and provide them a little more information. You can call them and make sure they're taking their temperature, making sure they're doing A, B, and C as it relates to what they're supposed to be doing. And then the COVID-19 cases filter, that will actually identify those patients that have either been diagnosed with COVID-19 or has tested positive with the COVID-19 lab results. And you'll want to use this one to identify your patients who should be flagged within your EHR or even followed up with to provide guidance on monitoring symptoms and even when to seek additional care. Because as you all know, even if you're diagnosed with COVID-19, not everybody's in the hospital. They send you home to quarantine, but a lot of these patients don't know what to do next. So this allows you to help out with this next screenshot here. I wanted to provide you as another reference point. So when these slides get handed out, how easy it is to choose these filters. They are just two filters, two little drop downs here. You apply the filter and it provides your list of patients to do what you need to do, whether it be the outreach proactively or to know who to reach out to based on positive diagnosis or lab results. So for those that seem interested in wanting to either have more of a conversation around the stuff that we're talking about today, or want us to show you a little more, or if you're already a participant with MX and this is something that you want to get signed up with because you're not, please reach out to Jenna Ariano, IHIO. Jenna and I work closely together. So this would be a good way to get that conversation started. So with that, that is the end of my slides. We'll quickly take a look at our MX training environment, those 3 tools around COVID-19, and Brittany has the fun job of doing that. So I am actually going to stop sharing my screen and hand it over to Brittany Weppler.
Great, thank you so much, Lacey. Let me get my screen up here. Okay, so for those that have never seen our tools before, this is the page that you'd see when you log in, and you can see all 3 tools over here on the left-hand side. So I'm gonna follow the same order that Lacey did, and I will show you MXNotify first. So this is the real-time customizable alerts when a patient is admitted or discharged from a hospital or receives a COVID positive result. So just to kind of show you what it looks like, I'm gonna actually show you a discharge notification first, just so you can get a sense of what a typical notification looks like. So we have demographic information, most recent event, and event history. The COVID positive notification is going to look very similar to this. So if I pull one up here, you'll see that under the most recent event, we're just going to see that under the diagnosis description that this patient has tested positive for COVID-19. So you'll see that it does look really similar. One thing that you could also do here is you could have a panel for all of your patients that have tested positive for COVID-19 so that you can know when they do show up to a hospital if they are recovering at home, for example. So this is, again, just a very specific notification that lets you know that they tested positive. If you want to dig in deeper to that patient's history, understand, be able to take a look at the lab results or just understand other information about that patient's full health history, that's when you'll want to take a look at MX Access, and that's the longitudinal health record that I will pull up next. And it's going to automatically bring up Terry's record, but I could also search for patients if interested. And you'll notice that right away, we have this COVID positive banner that Lacey pointed out earlier. And then we'll see COVID information down here in the lab results, which I can actually click and view in more detail as well. So you can see a lot of other information about that specific lab result. Within both MXNotify and MXAccess, you can view some demographic information as well, so that if you wanted to contact that patient, you would have the phone number and the address there as well. MXAccess also does have a lot of, it basically is one place where you're gonna find all the data that we have on that patient. So this is a combination of both clinical and claims data. So you could use this tool to really dig in on that patient's history, knowing that she did test positive for COVID-19, understand if she's at high risk and how you want to potentially follow up with that patient. Okay, the final tool that I will show you here is MXAnalyze. And that is a way for you to really scan your entire population and understand who's at the highest risk of inpatient admissions, ED visits, and mortality. We could go into detail on this tool for like 2 hours. There's so much really useful and really interesting stuff on here, but I'm going to keep this to really focus on COVID outcomes right now. So as Lacey mentioned, there's some filters that we have pre-populated, and you'll notice right now I don't have any filters applied, so we have a pretty large population here. But if I want to go into the attribution section here, and I want to click this customized cohort and view COVID-19 outreach. So again, this is going to be any patient that has things like cardiovascular, respiratory diseases, and we've lumped all of those into that one filter, so you don't have to really dig into those. We can just identify who might be at the highest risk of poor outcomes. And so we'll see that it's updated all of these categories for that at-risk population, which is now down to just 208 from about 300,000. And this is all, demo data, so there's no, this is not actual data. But when we go down here to the bottom, I can click and load this list of patients, and I can actually download that list as well. So I would have contact information for that patient, so I could contact them to make sure, as Lacey said, that they're taking their temperature, that they understand when they should go to the hospital if they're having any sort of issues, where they could get tested, and just making sure that they know what to look for and how to receive treatment should they need that. Now I can also go back to the filters and change that to COVID-19 cases. And again, this is going to be our cohort of patients that we know has tested positive. And I can again view a lot of other information on this subset of patients and their predicted risk. But then again, at the bottom here, I can still view that patient list. I can download it. I again have the contact information. I could even use this list to feed my Notify panel to know, who's showing up to the hospital that's COVID-19 positive, so that I can make sure to track that cohort. So there's a lot that you can do here, but we already have these filters set up for you to be able to use if you're interested today. Okay, Lacey, I think that was very high level. Happy to dig in, deeper in anything if there's any questions, or if there's other areas that you would like me to show. But that is a super quick overview of the COVID-19 sections within our tools today.
Perfect. Thank you so much, Brittany. I think that's good. It's pretty much covering what I talked about on the slides. I want to take time to be able to answer some questions. So let's go through.
Yes, we do have questions, and I will read them to you, and either Brittany or Lacey, or I see there's a couple of other MX folks on the call, so I will let you decide how you want to answer. So the first question that we have is, what is the cost for participation in Manifest Medx? Is this a subscription? If so, how much? Kind of two questions combined.
Sure. I'll since Brittany is Director of Sales, I'll hand it over to her.
Great. Thanks, Lacey. Yeah, so to participate with Manifest Medx as an ambulatory provider, there's actually no cost. So there is no implementation fee, no subscription fee. We do charge hospitals and health plans to participate with us, but you'll find they're typically much lower than others in kind of in the industry. So it's based off of net patient revenue for hospitals and per member per year for health plans. But for providers in an ambulatory setting, there is no cost.
Okay. Does MX apply to only Riverside County or LA and San Bernardino County too?
It applies to all counties. We're actually trying to work with as many counties as possible, so it doesn't only apply to San Bernardino and Riverside County.
So MX is actually a statewide organization, so you have providers throughout the entire state, correct?
Correct.
Okay. And just to kind of throw in there as well, so obviously San Bernardino and Riverside are two of our most concentrated areas as far as participants, but we do have around 25 hospitals in LA, about like 14 in Orange County. So we're really spread out and really cover the whole state. But also, I just want to throw out there, you know, as director of sales, if you have any, you know, any priority hospitals or anyone that you'd really like us to make sure to get signed up, please let us know. We're always looking for suggestions on where we should target our efforts.
Can you expand though on the number of hospitals in the Inland Empire that are participating?
Sure. Lacey, do you want me to take that or did you want to take it?
No, go ahead.
Yeah, so we have almost every hospital in the Inland Empire. There's a couple, we don't have Kaiser, and there's a couple of outliers here and there. I think there's basically like 2 or 3 hospitals that aren't connected to us currently, but other than that, we have pretty much every hospital in the Inland Empire.
Thank you. Does it matter where the patient had their testing done? Are we able to get the result for patients who were sent to a testing facility by their insurance medical group?
We only receive results on from organizations that are a part of Manifest Medx. For those facilities that send their patients to LabCorp or Quest, for example, we have been reaching out to those organizations to allow us to receive a copy of those lab results as well. So we don't get a result for everybody from every organization, only for those that are participants that have allowed us to receive those lab results.
Are you also receiving lab results from the county's lab testing sites?
So
go ahead.
Yeah, I was going to say we are getting results for the Riverside Department of Public Health lab, and we're starting to get some from other county labs as well.
Correct. Next question: is there a cost to integrate your EMR? And then, if so, what is the cost? Do you have a list of EMRs with out of the box integration?
Ooh, great question. I'm not 100% sure on the cost to integrate EMR. Erica, I know you're on the call. Do you by any chance know the answer to this question?
Yeah, this is Erica. I was just trying to get myself off mute. We do integrate with a range of EHRs. We try to prioritize those EHRs that are connected to a national network. That's our fastest way to get data into your clinical workflow. And we're happy to supply a list of EHRs that are connected either to eHealth Exchange or Carry Quality. That's even a question that you could ask your EHR vendor if you're not certain, or if you want to post your EHR vendor name in the chat. I can probably respond and give you a sense of whether they're on one of the national networks. We also have hubs, these kind of middleware machinery called hubs, with 3 different EHR vendors that allow us also to take data from your EHR into our system in a pretty readily available manner.
So I think for the people that are wondering along these lines, if you contact Jenna at the emails that we provided, or you can call the RCMA office to get connected to her. Then she can help you with specific questions. The next question, do you differentiate viral versus antibody results, and can you print a practice list of positive patients with names, tests, test dates, etc.?
Ooh, great question. So the CSV file that I presented earlier, that actually contains the name of the test itself with both positive and negative results. It includes, I believe, a date on there as well, along with the patient information that you may be looking for. So if you're looking for something like that, I think your best option to be able to print out something in regards to that would be that CSV file.
Okay. Where are you getting your data from? What about HIPAA?
Would you like me to speak to this one?
Yeah, please.
Manifest Medx serves as a business associate to the clinical organizations that connect to our network, as well as the health plan. So we take in clinical data from a range of organizations, hospitals, ambulatory practices, laboratories, as we've been discussing on this call. We also take claims data in from health plans. And in each of those cases, we have a business associate agreement in place with those organizations and very much function as a business associate across all of those covered entities. And so everything we do is HIPAA compliant. Our policies are structured to scope the permitted use of data that other organizations tap into our network to leverage, are also within the treatment, payment, and operations framework of HIPAA.
Okay, thank you. And let's see, can you include patients who have died related to COVID?
You know, at this moment, the notification that we receive as far as death data is just a flag within the information that we receive from the participants themselves stating that the patient is deceased. As it stands right now, there is no correlation between the two in that death data flag that we receive.
To reiterate something that Lacey mentioned earlier, if a patient passes away in the hospital, we will typically get that information from the hospital, and that will be in our system. We'll know that that person is deceased. Unfortunately, if folks pass away outside of the hospital from COVID-19 or any other condition, that's a limitation on our data today. We're very aware of it and we're working to address it. But we have to look to other data sources like the coroner in order to get a more complete set of information about that status of individuals. So that is one thing to be aware of. I don't think we've found it a hindrance in terms of use of our information, but it is certainly something to be aware of.
Okay, thank you. And Dr. Day had responded back. He is the one that asked the question about the EHR integration, and his system is the NextGen system. Can you tell us if that is one that has a portal?
NextGen does have a hub, and NextGen is part of Carry Quality. And so what we would do in that scenario, there's a little bit of configuration in the NextGen, what's called the NextGen Share portal. We can walk you through the setup on that. You have to turn on a set of features in that NextGen portal, and then that will allow us to move data between your NextGen instance and Manifest Medx pretty seamlessly.
Okay, thank you. So Dr. Dade, for your information, Jana will contact you and do further follow-up to get you connected. And also, Bill Devane is the MX staff person that was mentioned earlier about providing weekly webinars to receive a demo, etc. And so again, you can contact Jana and she will connect you with Bill Devane. if you'd like to see additional in-depth information on MX and all of its capabilities. Okay, well, it doesn't appear that there are any additional questions that are off the top of people's head, but again, please, Jana in the chat box has posted her contact information again. So please feel free to contact her, or you can, if you're in San Bernardino, contact the San Bernardino County Medical Society in Riverside County Medical Association, or of course IHP, as they partner with Manifest and the two medical societies in this, and they can connect you to the right people. So on behalf of RCMA, SBCMS, and IHP, I would like to thank Brittany and Lacey and Erica for presenting on our webinar today. And again, I would like to remind everybody about our webinar next Tuesday, same time, same channel, and you should be receiving the information on that webinar within the next 24 hours. So thank you again for participation, and we appreciate your support and your interest in our webinars.